Welcome to the Integrative Medicine Podcast. I'm Dr. Jordan Robertson. In this podcast, the best of both worlds of medicine come together, informing you of your healthcare options. This podcast is for the ultra-discerning, highly critical, and results-oriented health consumer, filtering out the good, the bad, and the real ugly when it comes to health information. As your host, my mission is to help you navigate the world of evidence-based integrative care and confidently make choices to help you live your best life. Enjoy!
Okay, welcome. This is the 18th episode of the Integrative Medicine Podcast. I'm Dr. Jordan Robertson, a naturopathic doctor, and I'm joined today by Miranda Tawfik. She is the owner and founder of the Origins Pharmacy, which is the pharmacy at the Oakville Trafalgar Hospital and also the Milton Hospital here in Ontario. And this is going to be such an important episode, and really like trying to narrow down what we wanted to accomplish has been pretty difficult because we started out with thinking that we wanted to talk about pharmacy and basically this untapped role that pharmacists can play in a patient's healthcare team, which then transitioned to us talking about some of the common challenges and myths around compounding pharmacies. This is one of the areas of specialty at the Origins Pharmacy, and which has then led us into talking about myths and challenges with treating women with hormone replacement therapy, specifically for menopause. So we will do our very best to get through all of these topics. And so basically I want to just start by saying thank you so much, Miranda, for being here.
Thanks for having me, Jordan.
And I just love your story. So if you can just start by describing, I know that you had a pharmacy before sort of taking on this like empire of pharmacies at the hospitals. Can you just walk us through how you even got into compounding? Because not every pharmacist is interested in compounding. Not every facility is interested in sort of the amount of work it takes to be a compounding pharmacy. Can you walk us through how you got here, going from, what you learned in school to this point where you're really pushing the envelope as far as what pharmacists are doing?
Okay, sure. So I started 18 years ago, and I was actually exposed to compounding at school, and I just immediately, it clicked, gravitated towards it. And when you're in school for 4 years and you're learning about every medication, every side effect, you're in this ideal world that when you go out to practice, these medications are going to fix everything. The truth of the matter is, once I started practicing, I heard the same complaints from patients over and over again. So either their blood pressure wasn't being managed, their diabetes wasn't being managed. More often, the women who are menopausal were not being treated effectively. And so when you listen to people, when you hear their stories, and it's all very similar, you start to realize that there's something missing, right? And so when that exposure to compounding in school really came into play, and so I started asking them questions. What worked? What didn't work? How are you feeling with this? How are you not feeling with this? What do you want to improve upon? Is it sleep? Is it your, for the women, for example, is it sexual health? Is it hot flashes? And so when you just have conversation, and my goal was always just to focus on the patient. How do you get them better?
Amazing. I can just think from my personal experience, I don't fill prescriptions very often, but I'm not sure I've ever had a pharmacist ask me any questions about what my actual goals were. And so with the compounding, I know my experience in working with and partly this is based on our limitation and prescribing practice in Ontario, is mostly around hormonal health. Mm-hmm. But I don't think that's the only thing that compounding can accomplish. What areas of medicine are people compounding things for? And can you just describe what compounding even means?
Sure. Compounding really just means that we're handcrafting, we're making from scratch medications to meet an individual's needs. So whether or not a patient has allergies to different fillers and medications. So we do lots of thyroid capsules, for example, who patient can't handle lactose or gluten or whatever it may be, those excipients in these commercially made tablets. We would customize it. We would make it from scratch without those fillers, so they could actually take it. So it ranges throughout every therapeutic category you can think of. So women's health, pain, pediatrics, gastroenterology, surgery, dermatology, of course. There's not one aspect that we haven't even delved into. So I even work with infectious diseases. There are some medications that are not here, that are not available, and they're life-saving. So
Oh, that's amazing. So basically, and I think when you and I have talked over the years about, especially coming around for things like dermatology, like it was almost my imagination on what was possible that was the limitation, right?
Right, that's
that
exactly it.
Technically, if we can come to you with an idea and say, can this be put in a cream? Can this be put, in a solution instead of a tablet?
That's right.
You've been such a good resource over the years to figure out like what was possible, right? And we've compounded some, shampoo for hair loss.
Yes.
We've done a few things together over the years that I think have been really remarkable.
Well, I think just like what you said, I mean, it also takes two like-minded individuals, right? You're also very evidence-based. You know that there's something available that has shown in the literature that will help. It's just a matter that it's not maybe in the market. Canadian market's small compared to the worldwide market. So a lot of medications aren't here, not because they're not safe, but because there's no financial incentives. So there's evidence. There's a whole slew of medications that are very effective. Yeah.
So I think when I talk to my patients about their pharmacist or their relationship with their pharmacist, like I think pharmacists are probably the most underutilized person on a health team, right? Yeah. I think that maybe patients don't quite understand the things that are available to them, like knowing that they can even have a pharmacist go through their medications. I mean, you mentioned to me just before we got started that even the volunteers in the hospital weren't totally aware of all the things that a pharmacist can do and what's part of your scope of practice.
Right.
The example I always give, like it's not just about going to, a drugstore at 11 o'clock and getting a bottle full of pills, right? That it's about like that person and you can get that kind of relationship and that experience that we probably all want from someone on our health team. Can you just sort of maybe talk about some of the things that maybe patients don't know that a pharmacist can do as part of their role?
Yeah, absolutely. I mean, I think a lot of the issue is just lack of awareness in the public, and our scope is constantly evolving, and it's really important for each one of us as a pharmacist to embrace that changing scope and do more to advocate for our patients. So we are very accessible. People come to us, but we don't just have to answer questions about toothpaste or, acne. So a lot of the things that have changed just in the last, other than, giving injections and making sure the medication's at the right dose, at the right time, the right frequency, that's just standard of practice. But a few of the other things that maybe the public doesn't know is that we are able to adapt a prescription, which means we could change the form of a medication to something that might be better for the patient. So, for example, if somebody is taking a medication for pain orally, and we know it wreaks havoc on their internal system, maybe that patient would require a topical cream to act locally instead. And so working with a practitioner, we would still have to work with a practitioner and notify them, but we're looking into what is the best avenue, what is the best form of the medication, is it the right duration. So we're able to do that independently now.
Which is amazing. So I think if patients are probably picking up their medications at 2 or 3 different pharmacies, they're probably not getting that experience or that level of care.
Exactly. So the best thing is to form that relationship. Just like you wouldn't go to, 3 different naturopaths. You should get to know, every single person. I mean, I don't like to comment on patients who come in and just say, hey, I'm on, these 10 medications. Are these okay? I need to know your whole story. I need to know your history. I need to know about you. And so I think that's the same. So you can get the most out of your pharmacist by just building that relationship, because then they can advocate appropriately to your, to other healthcare professionals. So.
And in Ontario, patients get access to a consultation with a pharmacist. Can you just explain that? Because patients don't know that when we tell them.
Okay.
So what is that sort of process? Is it called Meds Check? Is that
That's
the name
exactly
of the program?
It.
So what do they get?
It's a government-funded medication review, and it's not something that you would just have a quick chat. in the middle of a busy day. So ideally, somebody would make an appointment. If the patient's taking more than 3 chronic medications, we would sit down with them. And this usually takes me 30 to 45 minutes per patient. And they bring in all their meds, all their supplements, all their over-the-counters. And we review in thorough detail their disease states, what's working, what's not, how they're taking the medications. And perhaps then you can identify drug-nutrient interactions, or maybe they're on too many medications. So we also work very closely. Pharmacists can deprescribe. So if there's too many medications and they're actually not helping or doing harm, that's the time where you sit down and say, we need to reassess this and work with, again, the healthcare practitioner, the physician, to make sure that they're, taking the medications that they actually need.
Right. I imagine that feels like a lot safer of a space for patients to talk about whether or not they're even using their medications that have been prescribed,
That's
right?
exactly it.
I think it's common for patients to, report back to their practitioner that they're using their medications as prescribed, but I think it probably feels safer for them to have this third sort of neutral party to go through their medications and say, well, you were given 100 and you have 99 left.
That's exactly it. That's exactly it.
Obviously, you're not using
and they're not
them.
feeling rushed out of the room, right? When you make a set appointment and it's no charge to them, and they just feel safe that they can really, they start to come up with, they start to tell you the truth, of what's really happening behind the scenes.
Yeah. That's amazing.
Yeah.
So our relationship is mostly built off of supporting women for hormonal health. And again, that's partly my, sort of area of focus, but also our prescribing scope of practice in Ontario for naturopathic doctors does give us access to compounded hormonal therapy. And so a big bulk of what I end up doing is working with women in that perimenopause and menopausal transition. We're having compounded hormonal replacement therapy done for our patients, and it's been an interesting sort of process for me to work through over the last 5 years in understanding regulations on compounding pharmacies, because certainly if you just Google compounding pharmacy, you're going to get some pretty frightening information, and most of that coming out of the US. Can you just comment on the regulations in Ontario and how well regulated pharmacies are?
So I think we see a lot of the confusion coming when you Google about compounding pharmacies, and you might see something on Google about the US, and usually it's the FDA in conflict with compounding pharmacies, and they talk a lot about, they're not really regulated and whatnot. We're heavily regulated here in Canada, in Ontario specifically. We're regulated provincially, we're regulated federally, and it's ever evolving. I mean, even the type of chemicals we choose have to be Health Canada approved. The formulations that we're using have to be tried, tested, and true. So there's a lot of myths involved, of course. I think it's always important to decipher where that information is coming from.
Yeah, I think we saw the same thing in naturopathic medicine not that long ago. Things like the Fifth Estate and some of those sort of alarmist newscasts were doing topics on supplements, and most often pulling their examples from the US, where they would find Martha, packing pills in her garage, and then project that on, the risk that Canadians were facing in the natural product industry, which is not a fair comparison because our regulations are so different.
That's right. And again, within every kind of niche, you're going to find people who are not doing things properly. And so the regulations are evolving. And I think they're ensuring that the people who are committed to compounding are going to be the good ones, the ones who care about training, excellence, and standards and so on. So it's evolving.
So talking specifically about menopause, and I think one of the things I wanted women to think about and to maybe get out of this episode partly was to, certainly heavily involve their pharmacist as part of their health team, but also to think about when to seek support and which things they should be looking for in their life, as far as symptoms that would maybe help them identify when they should be talking to someone about their hormonal health.
Right.
And what do you see? I know your job isn't to do the sort of those clinical consultations necessarily as much as it is maybe mine, but you certainly hear on the front lines women starting to have symptoms that, and maybe it's we talked about this earlier, that women may have symptoms that can be chalked up to their hormones maybe 6, 7, 8 years before their final menstrual period, right? And so women will say to me like, well, am I menopausal? Am I perimenopausal? It's like we're looking for a label to apply when they've often suffered with symptoms that are related to their hormones for maybe 5 or 6 years prior to that last period. And it's only then that we can retrospectively look back and be like, oh, well, that's why you felt so bad for the last 5 years, right? What do you see on the front line and some things that women should be aware of that maybe they would want to talk to someone about their changing hormonal health? Because we always think about hot flashes, but that's not necessarily the only symptom we should be watching for.
No, you know what? I think it's a tough time to be a woman right now and try to decipher this information for, especially hormones. On one hand, they're still being told that it's a threat, that it'll cause cancer. And these are from sometimes they're MDs, sometimes they're friends, sometimes Google. On the other hand, they're suffering, and they've probably been suffering even through, teenage years during, with PMS and so on. So I think it's really important to kind of establish, the standards and basic knowledge about we're restoring hormones. We're not kind of trying to pump you up with hormones. We're trying to restore what is lost. That every individual, after the age of 30 and likely before, I think you've seen a lot of PMS conditions that are so severe that they, there are some girls who can't even manage for 2 weeks out of the year.
Yeah.
And so a lot of what I see is women who are still afraid. And so that education part is so important. And then we want to also refer to people like you, Jordan, who've literally transformed lives. You have, women coming back to me saying, why didn't anybody tell me this? Why didn't my doctor prescribe this for me? Why didn't, I know that I could feel better. My relationships have improved. My health has improved. I'm dancing in the house by myself. It's transforming. And so I think it's a tough place. I think we just need to continue to educate on medicine. This is biochemistry. This is our biology. It's not something, but it's not a fad that we're trying to come up with to create. It's real medicine.
I think that, and often what women don't realize is how many of their symptoms can be attributed to changes in their hormones. And so when we go through an intake with women, I often am going back to their first menstrual period, the experiences they had then. Did they have a history of Accutane? Did they have a long history of oral contraceptive use? Did they ever have windows of time where they had no period? Did they struggle with infertility? And when the sort of 48-year-old woman is in front of me, and sometimes it's that history going back through what her experience has been that helps us understand her perimenopause experience. But we go through every body system. Women experience changes to their urinary symptoms. Maybe they have frequency or urgency. They may have vaginal dryness. There's the hallmark hot flashes, but certainly sleep quality and the depth of sleep is impacted. Their mood is impacted. Their skin is impacted, right? They may feel like they have this accelerated aging all of a sudden. And body composition, which we've talked about in another podcast episode, also starts to change dramatically, where they're noticing they have weight gain around the middle and maybe a change or loss of their muscle mass. And often these symptoms are happening like 2 or 3 years before that last menstrual period, but we're almost like waiting for them to congratulate them that they're menopausal before we offer any solutions.
That's right.
That if a woman is bleeding, we don't really touch her.
That's right.
When really she just needs to be listened to, and it needs to be acknowledged at the very least. Even if we don't prescribe hormones during that window of time, at the very least, we probably need to do a better job of listening to how those women feel.
That's right. And so often they're coming in and they just think, well, it's just aging, right? This is the norm. This is how I have to, my mom lived through this, and so will I. Yeah. And that's what they're told too sometimes at their, primary, care practitioners, right?
Yeah, that's a really good point. And I keep saying to women that I see now that are between that 45 to 55-year-old women, their mothers were the ones that were pulled off of hormone replacement therapy. back when we didn't understand and had sort of the concerns around risk about breast cancer.
Right.
And women are complicated, right? We often take home the information that we're given and we think about it, we talk to our closest friends, we talk to our moms. And so we have a whole generation of women talking to their moms who were misinformed and pulled off hormone replacement therapy inappropriately in lots of cases. And so it's certainly confusing the issue for these women around whether or not this is a good solution for them. Do you point patients towards any resources that would give them some information about that, or where do you feel like they should learn about hormone replacement therapy?
I think they should learn from the experts. I mean, I'm not going to point them to Google, or maybe there are a couple of books, that you would, think about. But Jordan, you're very good at, the literature. But what I do is point them to practitioners who specialize in this field, because one, I want to initiate that conversation. I want them to know that what they're feeling is not normal, that they don't have to suffer through these horrible mood swings and whether they're bleeding or not, and sleep deprivation, etc. But I always point them back to an expert in the field, because that's your job to assess, to diagnose, to do the testing. There's no better care than that.
Yeah, I was just about to say, I think the thing when patients are gathering that kind of information online, the part that's missing is the assessment, right? That having someone sort of go through their symptoms in a very sort of neutral way, right? We always have a hard time diagnosing ourselves.
That's right.
Having someone go through and ask them all those right questions, but then also doing the testing that teaches us, right? We can tell through blood testing if women are ovulating. We can tell if they're having some signs of early ovarian failure. We can tell if their estrogen levels are low. And I like the way you put it, that we're not pumping them up with hormones. So we're not medicating women to be at the levels that they were at in their 20s, right? And the running joke is nobody wants to go back there anyways. But it's to get them out of that frank deficiency, right? And so the levels of hormones that we see in blood work for women that are menopausal, that are being treated for hormones, are just the very low doses of estrogen.
Absolutely. It's all about the lowest effective dose. I mean, we wouldn't leave a patient who's deficient in thyroid hormone to sit there and suffer. And so you restore that, right? You restore that slowly. You manage their blood work. You discuss their symptoms, and then their body starts working a little better. It's the same concept with hormones. You start the lowest effective dose in the form that's best for that patient to relieve different symptoms, and not just relieve different symptoms. I mean, it's overall health, right? It's brain health, it's heart health, it's bone health. And that's what I keep telling the patients. This is more than just, a hot flash. We're more concerned about your infrastructure. We're concerned about everything else about you. There's not one receptor that's not untouched, right, by these hormones. So, I think when they understand that, they have understanding. When they understand what progesterone does, when they understand what estrogen is there for, and it's not just this, oh my God, I don't want any estrogen in me, right? When they understand the concepts, their eyes kind of widen and they just think, oh my God, why didn't anybody tell me this before,
Yeah, I think and in my experience, this is one of the areas of medicine that still has quite a bit of belief-based practice.
That's right.
And so, which is unfortunate. I think gynecologists are doing a good job of hormone replacement therapy, if I were to generalize. But they often are not responsible for the long-term care of patients, and or for women to even get a referral to a gynecologist. She had to have been really suffering with her gynecological symptoms or her hormonal symptoms. So many women are still being treated for their hormonal symptoms at the level of family practice.
That's right.
Which is unique, right? Like in Canada, I've talked about this in other podcasts. Canada is one of the only countries where family medicine is your direct entry point for hormonal support.
That's right.
That almost every other country you see a gynecologist. Every woman in the United States and every woman in the UK has a gynecologist.
You're right.
Whereas in Canada, we've made family medicine the gateway to getting hormonal support, and we've made family doctors responsible for a lot of primary care medicine and hormonal health. I think that's probably why naturopathic doctors have had such an important role in hormonal health in Ontario.
That's so right. And I think they're, even the family doctors that I speak to, they'll tell me they don't feel, well equipped, that they actually wish they were, because they understand that they don't want to just give an antidepressant to, any woman who's going through this life change and so on. So a lot of the practitioners, but they're not taught that in medical school.
They're
right?
not.
So,
And I've had that experience too. I've had the good fortune of hosting family medical residents in my office with my relationship through McMaster University. And as a result of that, have built these great, long-standing relationships with family doctors who recognize that there's other professionals that have different education and hormonal support for women, and so we end up being a great resource for them. Absolutely. But that still ends up being such a one-on-one experience. That's me right. Having a good relationship with a family doctor,
exactly,
versus it being sort of the experience that women get en masse. And I think that's when I want to educate women about what their options are. I will say there are solutions other than the pill or Prozac, right? And they'll say, well, funnily enough, those are the two options they gave me, right? And so I want women to recognize that we're treating a hormone deficiency with an antidepressant, right? Because of how that makes them feel. All the areas of our brain and all the things that we do well as women cognitively are estrogen sensitive.
That's right.
Right? And so when we pull that estrogen away, women don't feel themselves. And I think that's often when women approach me for support, is when they'll say, I used to command the room at work, and now I'm teary in the bathroom before the meeting starts. And exactly. This isn't me, right? I don't feel like myself.
Yeah. And how many women just come to you and say, you know what, my relationship with my partner, my spouse, my children is being affected. I'm not myself and I can't control it. Of course you can't control it. Your foundation is rocky, right? It's just,
You're right. So for women who are looking for, so now we've given women these sort of ideas that, A, that these symptoms are not normal and they should seek help. B, that there's sort of a whole cohort of pharmacists that are maybe well equipped to help support them as part of their health team. What should women do with this information? How would you advocate for women to even start a conversation with their family practitioner, with someone about these symptoms and how to get the kind of support that they need for hormonal health?
I think they need to advocate for themselves. I think they have to just be proactive in terms of be curious, ask around, go to your pharmacy and say, hey, do you compound? Are you a specialist in bioidentical hormones? And then that pharmacist would typically refer them to a practitioner who's well versed in bioidentical hormones. So I just think that's just where it starts. I mean, if you ask your physician, a lot of the physicians will refer to myself so that I could refer to a specialist. And so I think it's really important to surround yourself with other like-minded healthcare practitioners, so you have a good network of people to help your patients, right? Just be curious, really, and ask.
Yeah, asking I think is really important. And even when family doctors or the person that you're working with says that they don't believe in hormone replacement therapy, first of all, the word belief just shouldn't even enter our vocabulary in medicine.
That's right.
But you can ask how they've come to that answer, right? And I think that can be a really effective way to help you understand their position on the topic. And it may be deeply personal for them, right? They may have watched their mother die of breast cancer, and it feels like deeply personal for them to, protect women from getting breast cancer, and they feel that they have your best interest in mind and that this is a good choice for you. But asking your practitioner how they came to understand the information about hormone replacement therapy can help you figure out whether or not their values are in line with yours.
That's so true, Jordan. And to define what they mean by hormone replacement therapy.
Right.
Are we talking about synthetics taken orally, right, that do increase breast cancer? How are we defining hormone replacement therapy? I mean, there are some people who still don't know the difference between a synthetic progesterone or progestins and progesterone. So I always ask, even when I'm talking to, doctors or anybody, what do you mean by that? What do you mean by HRT? Right?
Yeah, because there's a lot of, and even when women say, well, what about that one study that, right?
That's right.
In theory, we're talking apples and oranges, right? When we're trying to compare the risks and benefits of one drug, we can't project that onto another drug, and we never would.
That's right.
Unfortunately, with hormones, we have blanket termed hormones and put everything that qualifies as a hormone under the same umbrella.
That's right.
When the reality is the specifics of each individual prescription and each individual hormone are very unique, and
That's
the risks and benefits of them are also unique.
That's right.
And so that's a really good point. So I so appreciate your time and advocating for women and all the things that you do at both of your pharmacies. I think it's so important, and part of the reason I wanted to have you on the podcast and talk to you is partly to help patients understand how vital that role of a pharmacist can be on their health team, because we are often referring back to pharmacists to have conversations about medication, and it's almost like it didn't even cross the patient's mind that person actually knows the most about their medications and how to get the most out of their current prescriptions. So I so appreciate you coming on the podcast.
Thanks so much for having me today, Jordan. I'm so grateful to be working with you, advocating for women's health. It's really important to, work collaboratively. I think that's the best way to look into to helping treat women.
Yeah, and again, I can't thank you enough. I am going to put in the show notes of today's podcast a couple of resources that women can look at to help get a better understanding of hormone replacement therapy for menopause. I do suggest that you talk to your primary care practitioner about your hormonal symptoms and feel confident that there is something that can be done about them. And so hopefully this episode has given you, at the very least, some motivation to look for some support and look for a health team that is going to have your best interest in mind. And certainly book that meds check with your local pharmacist to talk about your current medications and what your goals are, to get that additional resource on your health team that is going to look out for you and have your best interest in mind.
This concludes our episode of the Integrative Medicine Podcast. As I strive to bring you the tools and advice you need to make well-educated healthcare choices, I hope you listen along. Questions about the podcast or topic requests can be forwarded to our email at imedresearchhub@gmail.com. Remember to subscribe to receive updates on the latest episodes through iTunes, Stitcher, or Google Play.